So let me go ahead and just start out by saying that there is no state funding, no state funds whatsoever are dedicated for family planning. All of the funding that comes to family planning providers in the state of Texas is all federal money. And that actually is very important because there are a number of different programs that family planning providers like Planned Parenthood in North Texas utilize, and we receive funding from so that we can serve, in turn, the women of North Texas who need family planning services. One of those, and I would say probably the most important, is Title X the Title X of the Public Services Act. Title X is a federal program that is solely dedicated to funding family planning services for low-income women. It was started in 1970 by then President Richard Nixon, and what it does is it provides that family planning services. It allows women who would otherwise have no access to any kind of health care whatsoever, access to vital prevention services, education, and it also allows them to help them plan their families, space out their births, and help them to make responsible decisions about their lives that they would otherwise not be able to make without that information. So that's one of the ways that we are able to utilize that funding. We do receive Title X family planning dollars through selected health centers of Planned Parenthood in North Texas. Though actually I do want to add that the majority of the majority of the funding that Planned Parenthood has at its disposal, Planned Parenthood of North Texas has at its disposal, is through the recycling of patient funds and also through the generous donations of our community supporters like yourselves. So it's really important to talk about that because a lot of people just think that we're just funded through the government, and this is just, it's simply not true. We rely very heavily on our patients and our donors in the community to help keep us going. Another important program that I want to point out is that Medicaid, National Medicaid, does provide family planning services for women who are enrolled in the program. And this is important, of course, because those women would otherwise have no other access to medical care as well. And this helps them to cover all of the spectrum of their health needs, not just general health care needs, dental, so forth. So it's really important for me to point that out because, as well, there's a specialized program here in the state of Texas that we have developed through cooperation with the National Medicaid program. And this is actually what we have called, well, what was called the Medicaid Waiver Program, but is now called the Women's Health Program. And what it does is the National Medicaid program allows us to take a certain waiver and to allow certain women up to, or to allow women up to a certain income limit to access family planning services only. And in turn, the national program reimburses the state for how many patients that they can see. It's a little confusing. Hopefully I'll be able to talk a little bit more about that. The Women's Health Program, like I said, is sponsored through Medicaid, and it's for women ages 18 to 44 who make too much money to qualify for traditional Medicaid, but not enough to afford private insurance or COBRA insurance on their own. And it allows them to, like I said, access family planning services only. These women would otherwise qualify for Medicaid prenatal and delivery care if they were to become pregnant. So the thinking of starting this program, which was started back a couple of sessions ago, was that if we're going to let these women access Medicaid for prenatal care, why don't we let them access subsidized family planning services through Medicaid to help them prevent that pregnancy in the first place. And of course, this program is really great. Like I said, it reimburses the state. It's not a block grant, unlike the Title X program. I forgot to add that in. Title X is actually a block grant, so the federal government gives the state of Texas a certain amount of money. Here you go. And the state disperses it to family planning providers throughout the state, and then we're in charge of just seeing as many people as we possibly can while trying to utilize those funding. But the Women's Health Program actually helps to reimburse through the number of patients that we've seen. So it's not just this whole block of money. We're able to be reimbursed by as many patients as we see. And I'm going to just pick it up here a little bit. I'm afraid I'm taking up too much time. The Women's Health Program, of course, has great potential, and it is a great program, and it has had the potential to be a great program. Besides the obvious benefits of reducing unintended pregnancy in the state and helping women stay healthy, the state actually estimated itself that the program would save taxpayers $467 million over 5 years just through the reduction of unintended pregnancies to program participants. And of course, again, realize that many of these women would otherwise become pregnant and would have to go on Medicaid to receive prenatal care and delivery services. And then that, of course, would cost taxpayers on average about $9,000 per woman per delivery. And just to put that in perspective, it costs on average about $200 a year to pay for a woman's family planning visits. So it's a great program. It saves taxpayers money. It helps reduce unintended pregnancies and thus, of course, reducing abortions, possibly. And we can help women stay healthy. So unfortunately, the Women's Health Program, it hasn't exactly achieved its cost-saving levels because enrollment in the program has been very small. It's actually at about 3% right now. This is because very few women even know the program exists. And that is because the state has allocated so few dollars to actually marketing the program. Right now, the state of Texas allots $50,000 a year, which is actually pretty abysmal for such a large state as ours to market this program. To put this in context, Alabama has a very similar program, and they are a smaller state with a smaller budget, and they spend 5 times as much as we do, $250,000, and they have over 75% of eligible women enrolled in the program. So that's just a little bit of overview of what we're coming up against here in the state of Texas when it comes to family planning access. Funding is very low. Again, like I said, there's very few women now that can access it, and unfortunately, our state legislature has made it a point to unload family planning dollars and divert them to other sources other than traditional family planning providers like Planned Parenthood of North Texas. One such attempt, and actually was a successful attempt, was known as Rider 56. And as many of y'all know who have been involved in the political arena here in Texas, riders, of course, stand for amendments, and it was attached onto the appropriations bill in 2005. And what it does, it diverts $10 million a year from the state family planning budget to federally qualified health centers. If y'all don't know what federally qualified health centers are, they're specialized medical providers and medical locations, medical clinics, that provide a whole range of healthcare services to families, to low-income families or rural families here in the state of Texas. I want to make it very clear that they provide absolutely wonderful services and they are important. However, giving those funds that the Rider 56 took away from family planning providers, giving those funds to federally qualified health centers has not helped to increase women's access to services. This is, of course, because demand on federally qualified health centers is very large. Federally qualified health centers, health centers have to deal with many patients. They're always busy. Their demand is so high that usually women are forced to wait months for an appointment or have to drive unbelievable amounts of distances to go see a provider that would accept and be able to see them for these, to be able to receive subsidized services. So, of course, like I said, we knew that this rider was not good, and we have actually seen its devastating effect on women. Since the rider's implementation in 2006, more than 70,000 fewer women have received services through family planning services. These women, of course, because they weren't able to receive those services, they weren't able to have their yearly checkups, they not only face unintended pregnancies, health problems such as cervical cancer, breast cancer, reproductive health conditions, and they're also at risk of STIs, including HIV. So that's what we've had to deal with. And unfortunately, last session, we were not successful in removing Rider 56 from the state budget. But we were able to get a provision included on the rider that says that any federally qualified health center that has not spent those allocated funds by a certain time, that they would have to give those funds back to the state, which would be in turn redispersed through traditional family planning providers. That's what we've had to deal with. But Rider 56 was not the only amendment that has affected the family planning budget here in the state of Texas. Providers and advocates like Planned Parenthood have also had to deal with a new program that was started in 2005 called the Alternatives to Abortion Program. The Alternatives to Abortion Program takes away $5 million every 2 years, so 2.5 every year, from the family planning budget, and it gives that money to anti-choice crisis pregnancy centers. I don't know if everybody here knows what crisis pregnancy centers are, but they are these clinics that are set up by anti-choice groups that are intended to mislead and lie to women about and intimidate them regarding access to abortion and information on abortion. So these clinics are not licensed, nor are they regulated by the state, and they do nothing whatsoever to help women avoid an unintended pregnancy in the first place. So our family planning dollars that could go to really help women, provide them with services that would keep them healthy and avoid an unintended pregnancy in the first place, are going to these clinics that are not licensed and are not regulated, and their sole purpose there is to dissuade women from seeking information on abortion. So to date, the agency running this program called the Texas Pregnancy Care Network, which was created just about that same time to take advantage of this money, has not spent the entire amount allotted each year on the services to patients. In 2008, which that's the most current numbers that I have, the program served only 8,040 women, while spending 40% of its government funding on administrative expenses, including increasing the CEO's salary from $93,000 to more than $100,000. These clinics also use this money to help operate a 1-800 number and a call center, which on average gets about a call a day from women looking for services. So just to put this in reference, in 2008, Planned Parenthood provided medical services to over 83,000 women, and 27,000 of them received help with government funding that we received. So obviously the Alternatives to Abortion Program has been a stupendous waste of your tax dollars. So I hope, and that one as well, we were unsuccessful in changing anything on that one, on that program. Actually, as a matter of fact, the bad news is that the state legislature increased the funding that they took away from the family planning budget from $5 million to $8 million. So, last but not least, I talked a little bit about the Women's Health Program, and that one actually we wanted to. What our objective was last session was to increase the state's allocation for their advertising or their marketing budget. A lot of people at first, when they heard that we were doing this, they said, wait, you're going to be using our taxpayer dollars to pay for advertising for a healthcare program, but it's all about investment. The more women that we can get enrolled in this program, the more women have access to healthcare, the more women we can help prevent unintended pregnancy and so forth. It's a domino effect, but we have to get that information out there, and to be honest, $50,000 is enough to print up brochures, and that's about it. It's really quite abysmal. So that one, actually, we decided to introduce legislation that would call upon the legislature to increase that allotment, and that bill was actually dubbed the Prevention First, or the Prevention Works bill, and that was sponsored by Representative Mark Stroma of San Antonio and Senator Kirk Watson of Austin. Unfortunately, that bill, which of course included many other facets, that bill did not go anywhere, but we are going to try again next year and see what happens on that one. So let's see now here. So that's kind of, we would say that overall, in terms of family planning, the family planning budget, it was actually pretty successful. We were able to hold off quite a few attacks on the family planning budget, and of course we got in the language on the Rider 56. excuse me. But we were also successful in increasing the the family planning funding to $7 million. And, excuse me. So that's pretty much all that I can report on that one. But otherwise, I mean, it is a pretty success. It's incremental change, but it's still a success. And we're hopefully going to be successful again next year in convincing legislators that more attention and more funding needs to go to helping women prevent unintended pregnancies and health conditions in the first place. So I want to move on real quick to what we did in terms of advocating for comprehensive sexual health information in Texas. How am I doing on time? Okay. Comprehensive sexual health information in Texas. Of course, like I told you, sex education in Texas, quite honestly, is a joke. We are an abstinence-only state. We are actually the flagship state for abstinence-only education. Abstinence-only education did start here in Texas, and Texas receives the most federal funding for abstinence-only education than any other state in the union. So, in our goals to address and possibly, increase sex education and information out there in the community, we really wanted to introduce a special bill called Education Works. Education Works, it's a great bill. I love talking about this all throughout the session, and I'm glad that I'm here tonight to talk about it again. And what it called for was requiring sex education and programs in Texas to base their curriculum on scientific fact and not just ideology. It would require any sex education program in Texas to provide balanced information on abstinence and birth control and condoms. So teens and young people would receive an equal amount of time and an equal amount of information on all of their prevention options. And so not only that, but it would also, it encouraged programs to talk about things like responsible decision making, goal setting, relationships, healthy relationships, talking to parents and talking to trusted adults about sexual health information, trying to get that conversation started. So it wasn't just, we're not just throwing information out there at teens and young people about, well, this is abstinence and this is birth control, and just leaving it to there. We wanted to encourage them to be healthy adults and to help them make those responsible decisions, not just through using whichever method that they choose, whether helping them decide, it was great for them to be sexually abstinent, but if they decided not to be, for them to protect themselves, but also to help them have healthy communication skills and for them to trust in adults and to trust in coming to us whenever they had questions about this. So that's a little bit on what that bill addressed. And there were many other facets to it. It was sponsored by Representative Castro of San Antonio and Senator Ellis of Houston, those two bills in the state and the Senate. I am sad to say, though, that Education Works did not get passed by the Texas legislature, which, yes, what a surprise. But that's okay. We were successful to a point because this bill, we've introduced similar bills before this in other Texas legislative sessions, but this last year was the first time that we were able to get a hearing on it in the House Public Education Committee. Unfortunately, it didn't move after that, but we were at least able to get a hearing. So we're talking it up to a success. It's incremental, so hopefully next year, if we're able to get the hearing, then we're able to get the vote on it, and so we'll see what happens. But at least it was good to bring testimony and to talk to our legislators about this and to see it actually move somewhere besides just sitting in committee. And we did make one last attempt towards the end of the session to make sexuality education, in the state of Texas medically accurate. During the debate over another education-related bill, which was Senate Bill 283, which had to do with shacks and how many times a year that they meet, and I won't go too much into that one. Representatives Castro and Villarreal actually attempted to attach amendments onto the bill that would have required information in any sexuality education classes to be medically accurate. That's all it wanted to do. It didn't say, you have to talk about condoms or contraception. All you have to do is say that any information, or all that it called for was that any information in these programs would be medically accurate for our young people. Nothing that was based on ideology, nothing that was just based on hearsay. They wanted it to be backed up by peer-reviewed scientific evidence. However, the sponsor of Senate Bill 283 refused to accept these amendments to the bill, and actually the sponsor was actually a pediatrician, which is a little ironic to me. He refused to accept these amendments because he didn't feel that they were germane to the bill, and so of course they were defeated on a point of order. But that's okay, there's always next year. So I'm sure that it's, a lot of people are interested to, those are what we call the good bills. Those were the ones that were proactive, they were prevention related, they were about helping women prevent unintended pregnancies in the first place and get all the information that they needed to help make themselves, to help live healthy lives and to help create healthy families. However, we did have to face some pretty bad bills as well. We had to face some attacks on a woman's right to choose. We had to, we faced a lot of opposition, or a lot of the opposition's efforts to really chip away at a woman's access in the state of Texas to abortion care. And 3 of these very heinous bills, actually, I wanted to highlight. There were many more, but the 3 biggest ones, and I'm sure that you heard at least of one of these during the session. The first one that I wanted to kind of point out to was what we called the ultrasound measure, but it was a bill that was sponsored by Representative Frank Court of San Antonio and Senator Dan Patrick of Houston. It would have required doctors to perform an ultrasound for every patient wanting to end a pregnancy, explain the ultrasound to them, and broadcast the fetal heartbeat if one was available. The bill originally only allowed women to, quote unquote, avert her eyes if she chose to. Yes, avert her eyes. But we really opposed this bill. It was for a number of different reasons, mainly because it was a direct violation of the doctor-patient relationship. The state has no point whatsoever in getting involved in how doctors care for their patients, what information they do decide to give them, and what information that they feel is in the best interest of the patient not to give them. And I know that sounds kind of a little bit scary that doctors would withhold some information, but looking at it this way, if a woman were facing an unintended pregnancy, or facing a very much wanted pregnancy, but found that there was a fetal anomaly or some kind of fetal defect that would, she would have to end the pregnancy just because she wouldn't be able to carry it to term, or for any other reason if it was wanted, and she would have to be forced to look at an ultrasound, it would only prolong that pain. And a doctor could feel that an ultrasound was not in her best interest. And of course, it was just it was one more attempt for legislators to tell doctors how to treat their patients and remove the doctor's ability to base their care on whatever was appropriate for their patient or medically necessary. We also said during the whole debate over this measure was that the separate group that Planned Parenthood refers patients seeking abortion care to, the one that we refer to, they already do ultrasounds, and they already give the opportunity for women to see their ultrasounds, but mandating that women would have to receive this and that they could only avert their eyes really left out the choice for them to decide their own medical care. And it was, in the end, it was just a political tool that was being wielded to shame women about their choice to terminate her pregnancy. So another bill that I wanted to kind of gloss over real quick was actually a bill was introduced called the Choose Life license plates. And these bills were sponsored by Representative Larry Phillips of Sherman and Senator John Corona of Dallas. Yes, so from our own North Texas neighborhood. They would have directed the state to create and issue license plates that said Choose Life, and have those funds from the sale, any funds that were generated from the sale of those license plates would go directly to organizations that specifically do not perform abortions nor refer to abortion providers, mainly would have been crisis pregnancy centers. So not only would have crisis pregnancy centers have gotten funding from the family planning budget in the state through the Alternatives to Abortion program, but they would have also gotten funding from this. As well, we of course opposed this one as well. We felt that this amounted to a government endorsement of one viewpoint, one political viewpoint. There was no other bills that were introduced that called for pro-choice license plates, so it would have only been these, and there was nothing else written in the bill that said that there was an option for pro-choice license plates to be introduced. And of course, because the monies could not be fairly distributed to all organizations in the state, only to those the state felt it deserved, only the organizations that the state felt deserved the money because they did not perform abortions or that they lobbied against it. Similar legislation was passed in other states, and it was challenged in court by pro-choice groups. So if this bill had passed, it would mean that the state would be facing a very expensive lawsuit and a very time-consuming one, and would, of course, take vital public funds away and tie them up in costly litigation. And then the last bill that I kind of want to go over real quick, and I promise I will wrap it up here in just a second, is that there was an abortion reporting requirements bill, that we called it, and it was sponsored by Representative Jeannie Morrison of Victoria, Texas, and Senator Florence Shapiro of Plano. And these bills would have required doctors who perform abortions and their patients to report unnecessary and invasive information to the state before allowing the procedure to take place, before allowing the abortion procedure. Some examples of the information that would have been required would have been the county of residency, marital status of the patient, method of payment, transportation mode, whether they had any living children, how they were referred to the provider, et cetera, et cetera. And none of these requirements, of course, would have made this care any better. It was just a thinly veiled attempt to obtain information about these patients and then, of course, to make this information public, which very serious breach of confidentiality. And of course, we oppose this legislation. As I said, it endangered the privacy and safety of patients seeking abortion care and doctors who provided them. For patients living in rural communities, publishing their county of residence or any other identifying information could lead others to figuring out who these people were, identifying them. And also, no other medical procedure in the state requires such reporting. Abortion would have been singled out, and this could pose a huge barrier that would have dissuaded women seeking care from actually seeking it on time. So anyways, what happened to these? Well, the ultrasound measure, like I said before, that one actually did receive a hearing in the House committee that it was referred to, but it did not move after that. However, the Senate version really did get a move on during the session. I believe it got all the way as the House Calendars Committee, and it was only it died in the final days of the session because it was unable to make it to the House floor for a vote. The Choose Life license plates, we came this close to having, or it came this close to being passed. Let's see now here. The House bill did not get very far, but the Senate version actually was passed by both the Senate and it went over to the House, but in the final weeks of the session, Representative Phillips, who originally sponsored the standalone legislation in the House, added an amendment to two other transportation bills that would create these license plates. And these bills were passed and were debated on the House. And during the debate of one of the bills, Representative Lon Burnham of Fort Worth introduced a pro-family planning, pro-choice license plate amendment to the bill as well to make it even. Unfortunately, that amendment by Representative Lon Burnham was tabled, and it died. And however, the transportation bills with the amendments on them did pass. Or they passed out of the House, but I think that they came this close to being passed in the Senate, but they didn't get to it in time before the end of the session. And then, of course, the abortion reporting requirements one that would have required all that information. I believe the Senate version was very fast-moving, but the House one, again, failed to get very far, but the Senate one died before it was able to get to the Senate floor for a full vote. Okay, so finally, what does the future hold for reproductive rights and reproductive health care access in the state of Texas. Of course, as I'm sure that many of you know, we are going to be having another state legislative session coming up next year. We can expect to see many of these anti-choice bills come back, including the ultrasound one. The abortion reporting one is actually, I've been through 2 Texas legislative sessions so far, and both sessions I've seen that reporting bill come up, so I'm expecting to see that again. The ultrasound bill, and as well, we're probably going to be seeing a lot more legislation on sex education, making it better here in Texas, increasing family planning access, legislation that is increasing marketing for and outreach for the Women's Health Program. And so I would just encourage everyone, of course, to keep their eye on that when that comes up next year, and also as well to keep your eye on what's happening up at the federal level, what's going on with sex education, because we almost got abstinence-only programs done away with, but at the last second, an amendment was added on to the healthcare reform legislation that renewed abstinence-only education funding for, yes.